Recorded. I am Dr. Prasanna Venkatesh. I'm the chief instructor for the next 1 hour. So we are going to have a special instruction course on how to use your PowerPoint, how to use certain tools. We'll try to cover it in a very basic way, and we'll answer your questions also, sir. Whatever you have, you can pause us in between also, so that we'll start on time and we'll end on time. So the first presentation will be Dr. Shruti. She's a very young and prolific cataract surgeon and academician. So over to Dr. Shruti Vaishali on how did she use the webinars that happened, how did she innovate herself during the webinars, and also certain important apps in ophthalmology, how did she started using them for her image editing and so on. So over to Shruti for the green mat and the applications in ophthalmology.
Good morning, one and all. I'll be talking on the green mat user. So I think we all know that the moment COVID started, we entered into era of basically it was all free webinars, and it actually was useful because instead of going to places, we can sit at our comfort and get all the information at our fingertips. But definitely, as ophthalmologists, we know the asthenopia symptoms that were going to happen. And yes, always the distractions in between. We tend to go towards a lot of YouTube videos and Facebook, social media, all our Amazon shopping, definitely the best way to do it. Organizing our mails, as I said, social media. And another important thing was the offline effect. Even though we were sitting on an online webinar, there was always times in which we used to feel disconnected from the speaker as well as the audience because we are not directly interacting with them. So that brings us to the offline effect in cases of online webinars. To overcome this was something that we suggested was the green mat presentations. So we use the software for our iOS devices, which is the Open Broadcaster software, which is a free software. And I'm going to teach step by step on how to use it to make sure that we can do a green mat presentation in our own places. So once we open the Open Broadcaster software, this is what you're going to get. So once you open up the toolbox over there, these are the settings that we have to go through to make sure that we can set up the green mat. So the first thing here would be to set up the audio input capture because we want our audio to be displayed properly, and obviously do that connected to whatever device that you're going to talk through, either directly at the microphone or your earphones. And then we have the video capture device. So it should be connected to the laptop's computer, laptop's camera, and then chroma key, very important setup because what mat you're going to put behind you. Sometimes some people will use a blue mat, sometimes people will use a green mat. So depending on that, set it to the appropriate color, either a blue or a green or whichever color mat you're going to place behind you. And then once that is done, now we want the PowerPoint presentation to be presented behind our back so that you're standing inside the PPT. So if that's the case, you need to go to the window capture setting and make sure in the window setting you have what PowerPoint that you want to present. And then you come to the virtual cam setup. So virtual cam is what basically where we are going to throw ourselves into the PowerPoint. So in the virtual cam setup, you're going to bring about the box of different sizes. You can either be just a small half-sized portion or even a full big-sized portion inside your presentation. And anywhere inside the presentation, you can place yourself. It can be in whichever corner you want it to be. And then finally, very important step, the moment you join your Zoom meeting, do not share your screen when you're doing the green mat presentation because directly it will be presented. You just need to go on to the Zoom. In the video section, you go set the camera to the OBS virtual cam. Ideally, it will be in our PC camera, but go to the OBS virtual cam. And once that is done, so this is kind of the initial setup that we had. You can see it's a very crude sort of setup because we needed to have our laptop which projects the projector onto the presentation. And then we had, if you can see, there is a small phone over there. So that basically showed the presenter where he is inside the presentation. And then this was the laptop which had the presentation actually. So we had a very crude setup initially. It took us some time to fine tune it, but finally we were able to Finally, we were able to bring about a much more cleaner setup. We brought it about. So we can see that we made sure that the green mat was set entirely over the presenter, and we had the screen displaying the PowerPoint in a huge one in front of him, so he was comfortable enough. And this was the laptop that displayed the presenter into the webinar. And you can see that it was all in a very well set up format. And another aspect that something, even now we feel that, even if it's an online quiz or some program that we're attending online, the drop boxes, because then the moment we close up the drop box, it becomes sort of like a YouTube video, an offline effect. That's what is something that we're trying to prevent. So in such scenarios, you can give movement within the frame. So you can actually move inside your frame. If you're abstracting some information inside the frame, you can actually move about and show them what it is that you're abstracting. You can point out to details inside the presentation. So this all brings about a very lively effect. But caution is, do not become a floating head, because the moment we wear blue or green inside the green mat presentation, we just become a floating head. And so the final point I would like to summarize is more interactivity with the green mat presentation, and gives us more clarity and creativity, because not only for the audience but for the presenter also, I guess it becomes a more interactive session. And it makes us feel like we are live over there. So thank you once again, Dr. Prasanna, for this wonderful opportunity. I would like to thank my team for this wonderful green mat presentations you are able to give. So that would be the conclusion of my first presentation. Sir, any doubts so far? Yeah, so I'll go ahead with the second video.
When we started having webinars, we were all inside boxes. So this presenter is in a box, the audience, the faculties are all in a boxes. So we are not able to have the physical face-to-face interaction. Sometimes we point at a slide, but they don't know which slide we are wanting them to see. We'll be moving the mouse over the slide. So what we try to use with this green mat technologies, we can move inside the slide and we can show where we want the users or the people who are attending to see. So that's all about the technology, so that we can show them, okay, please look at here at the disk. So that means we are able to make them see there. So that was this all. So I'm able to show a pointer now, but inside the webinar, I'll go in and I'll show with the green mat, you please look at here. So this is where the cup is. So something like that with technology, we try to establish that. Now moving on to the next talk. So at any point of time, please do stop us. We are very happy that we are having you here because you are our moral support. So we'll move to the next talk, the eye apps in ophthalmology. Over to you. So this is a presentation by Dr. Satyan and Dr. Shruti. So over to them. Yeah.
So this is one of my favorite topics actually, because it's very simple, very free apps that we use to create, award-winning photographs so far. So these are all like award-winning photographs I'm showing. So it's all very simple tricks. I think if we were able to use it, it would be the best outcome that we can achieve. So our team's motto is that a picture can speak 1,000 words. So why does image editing and representation matter? So this is one of our personal edited images. So you can see it's a gonioscopy photo, but the way we present it is something that is unique, and it's not done before. So you need to create ideas which are unique for yourself. So start with the image acquisition. So it works well with how good you capture the image, because if the quality of image is going to drop beyond a certain level, no matter what we do with it, we are not going to be able to create the effect that we want it to have. And then build your own style. So as I was saying, we need to have our own unique style, our own unique story. As I tell your story the way you want it to be told, by through collages, through editing, how exactly you want it to be. And no matter how small the adjustment, sometimes we might feel that brightness, saturation, contrast, how does it matter? But it matters a lot. And collage making is an art that we all have to learn, because right now we have all the tools at our fingertips. So we have to make sure that we use it for the utmost importance. So as I was saying about the image acquisition, so you can see that we never capture just photos. We always take videos, even for the minute details. We take videos of the cases from the start to end. So you can see that we start focusing from the cornea, we focus at the iris, we go to the lens. So that even if the patient moves their eye in between, we have a clear image which we can screenshot later. So most of the time we end up taking 5-minute videos, so that we have immense number of screenshots which we can work on later. So similarly, if you can see, this is another video which we had stained. So this is basically an MMC bleb to look for leakage. We had stained. So different focal points, because we know with slit lamp, even the minute movement, the focus will go off. So we have to take videos. That is the best way to capture an image. So ultimately, the end point of this image was, you can see here, this was one of our award-winning photographs in IRSA. So you can see that from this, we were able to capture these images. And obviously, these are multimodal imaging using OCT and Sheen-Fleck images. Another technique to bring about more life to your image is the multimodal imaging. So whichever way we can capture it in different settings, make sure it happens. So this is one of my personal apps, which is the POTO, which is available free in iOS devices. And for the past 3 years, this is the app which I have been using. So you can see that I'm just going to show a short video on how exactly I collage using the app. So once you go into your app and you can choose whichever number of images that you want to choose for collaging it. And the moment you choose it, it's going to give you a particular layout. So once the layout is there, now it's all with your touch interface. So you can just long touch them and you can change the position. It gives you almost different types. I can imagine up to 50 combinations in which you can organize your images in the collage format. But choose it how you want it to be based on what the story that you wanted to tell. Which image is going to get the maximum space and which is going to be in order wise A, B, C, D. So choose the story you want to say and the format you want it to be. And once that is done, as I was saying, this is the format I chose finally. Now this was my primary image. So I just long pressed it, drag it and drop it. It just exchanges. That's it. And now I just need to resize these images so that they all look, in the same size. And I want the full image inside the box. It's all very simple. You can see how much we can work on this app. And it's free, completely free. You can use it. And one important thing, it does not reduce the size of your image. The quality of images stays the same, and you can download it directly from your phone onto your laptop. And finally, as I was saying, the margins and the inter-image spaces, it has to be very neat. And finally, you need to give a very clean image. So it's very important that we do that. So you can see we have made the final adjustments, and in the end, we have the image that we want. Yeah. So similarly, as I was saying for the gonioscopy, so we do the gonioscopy with the video, and then I do screenshots of the different angles. And finally, you can see I have taken all the 4 angles. Same way through the different layouts in different ratios which are available, I go through them. And the best layout that is possible for it, I choose it. And finally, you can see that I'm going with the sort of a kaleidoscopic and a geometric view for the gonioscopy. And it's more clinically relatable also, the way I have adjusted the gonioscopy images. And you can see it's very simple to exchange images in between the frames. And finally, once that is done, readjust it so that you can see all the angles are coinciding with each other. And you can see the final image over here. As I was saying, again, the margins and the inter-image distances, and you're done. So once that is done, as I was saying, organizing your collage only when needed, because most often there are a number of images needs to be limited. So we think whatever image we are capturing, we'll put it onto a collage and give the reader or the viewer our entire database. But do not do that. Only when needed, do the collaging. Before collaging, edit each image separately. Very important. Do not edit your image after you do the collage. Then because different images will need different brightness, saturation, definition, etc. So this is, for example, a story that we are telling, which basically you can see it's PI has been done in this case. So right eye, left eye, and there's hyphema. So post PI, we are doing a gonioscopy, which shows open angles, and then we are doing a dilated examination. So that's how you tell a story with the collage. Similarly, proper annotation inside the collage, because you have beautiful images, but without annotating them, you're not going to point out to where you want the viewer to look at. So make sure you have proper annotations. And similarly, as I was telling, the size of the annotations, it should not be too huge or too small. It should all be organized within your collage. It should make sure that they're all aligned together as much as possible, and same color concepts, same for example, we're using an asterisk and arrow here. Make sure you stick to minimum number of annotations. And if annotations are not needed, do not unnecessarily use them. For this image, the only place where I needed the annotation was in the Sheen-Fleck image to show this ectropion tissue. Otherwise, remaining every other image was self-explanatory. And if you put more annotations, it's going to destroy the quality of your image. So follow-up images, similarly, as I was telling, try to align your annotations as much as possible so that it gives the viewer a very comprehensive outlook. And finally, I think this is a question we all have. Some of our fundus imaging capture devices does not have the montage function, but we are able to capture various regions of the FFA or your fundus. In that cases, it's a simple Photoshop work. You just need to take the different regions that you have captured and just cut off the black areas and use the retinal vessels as sort of a stencil to do your trace work. And you can align each image one over the other in sort of like a puzzle like manner. And in the end, if you can see, you're going to get the beautiful ultra wide field or the wide field photograph that you wanted to have. And finally, as I was saying, definitely some small work with the contrast and brightness. And finally, once we have done everything, this is an AI app that we use to enhance our images. So this is the Deep Image AI. This is a paid app which is available online. So you can upscale your images because for example, this was one of our FFA images with the false color. We thought it had a very good outlook, but then you can see the pixelage over here, the breakup. So what we did, we just upscaled this image, and you can see the beautiful outcome of it. And you can see that it has completely removed all the artifacts and given us a very clear image. So do not hesitate to use upscaling, and as I was saying, focus on what you want to show more. This was the whole image, but we cropped out what we wanted, and again I enhanced the image, improved the contrast, the saturation, and the final outlook is something that we want. So what I wanted to say is, even in cases where you're doing a publication, tell your story how you want it. For example, this was our initial publication, which was a letter to editor, but we wanted it to be a sort of story told through images. So we actually had 13 figures in this publication, and you can see it started out with the local area network, how it connects different technologies inside your hospital, and then we showed where we kept all the instruments inside the hospital in another image. And finally, we showed them how to connect the technologies using the switch boxes. And then we went about to even show simple photos as where you're putting your LAN cable inside each machines. And finally, how to set up the IP address inside your laptop, and how to set up the IP address in your fundus camera or your Sheenfleck image or your OCT image. And then we showed comparison between the EMR and the LAN network in cases of fundus images, comparison in visual fields in EMR and LAN network, comparison in showing the comparison between a visual fields and a fundus photo in LAN network. Similarly, fundus photo and OCT in LAN network, which is not possible in EMRs. And then we showed a difference between the hard copy and soft copy. So basically a total of 13 images for a letter to editor, but that is our style and how we tell our story. So these are a few images. Basically this one, the 7 images won in our ACRS 2022 awards. So you can see this is how we work on each image. And then you can see that even if it's a small image, this is just an idea, but how you project it and how you finally upscale and bring out the perfect image matters. And these are, again, as I was saying, some of our images which won in the IARSA 2021. Multimodal imaging is something that we have to definitely look forward to, because it brings about a very different outlook. And these are some of our cover photos. Thank you. I think
So to summarize what Shruti is telling here is, today an image speaks 1,000 words is what we all know. So how we can actually, the image acquisition that we get, and how with the image acquisition that we are processing, there may be slight glitches with which we can have certain enhancements, and then the image can be much presented in a much better way. So and she also covered the apps in ophthalmology. At any point in time, the attendees, please do stop me, and you can also share your views, and we can have a one-on-one discussion. So anything that Pranesh and Pavan should want to add also, you can just add. And anything you want to add on the applications, Pavan, for the benefit of the audience? And
the IMG application, right?
yeah, any apps in ophthalmology. No financial disclosure there.
Yeah. See, the basic, like everybody has a smartphone now. Now everybody we are moving towards the app area where everything is made in the app. So it's more easier for the students to understand when they can see it wherever they want. So that is what one of the app Prasanna had designed. I really like that app, and we should all promote that app. Actually, it's not like financial disclosure, but still it's for the learning point for
the app is also free of cost.
Yes.
So
yes.
I've just given you the QR code in one of the papers to all the attendees. So it's also free of cost. So without much delay, we had two presentations. We are moving to the animation part. So today we have a lot of presentations, but a crowded slide is something that I personally don't like. I like to keep my slides in a very moving format. So how to make a 2D and 3D animation is what I'm going to cover in the next few minutes. So you can see I start with an animation of an angle recess here. So this is an animation of an angle recess. An animation really gives lot of cognitive detailing to the users. So we have our own YouTube channel. It goes under my name, Prasanna Venkatesh Ramesh. You can at any point in time do visit all the animation bouquet that is there in my YouTube channel. And to start the PPT, I would like to show you this one animation, a glaucomatous cupping with notch. The whole glaucomatous process you can see has been summarized in a single animation. First we show the fundus, then we show the animation of how the cup disc ratio is enhanced by showing how in between we have a vertical line. Then I'm showing the inferior notch here as to how the notching happens. And then we zoom in further and we show what is a bionetting sign. And then we zoom in more further and show ISNT rule is breached. So then we kind of zoom out and we show the RNFL defects here. We map a special color for it. Then we go on top and show how it corresponds to a superior arcuate scotoma. And then we come out and then we summarize with a ganglion cell layer defect. As you can see here, there is a mild ganglion cell layer defect corresponding to that inferior RNFL and summarizing the focal points. So in 1 minute, if somebody asks me, can you summarize a glaucoma defect? So that is where we are moving towards today. So we show an animation and then we show the focal points. So then we give a good take-home message to the users, especially in YouTube or in Instagram Reels. So these are my friends here who are also making a lot of animations like Pavan and Pranesh. They'll also be sharing their views. So this is the future, my dear friends, where we'll be sharing complex topics in a single minute. So less is more, I would like to say. So moving on to the angle animations, where you can see the iris process here, the ciliary body which is slightly pigmented, the scleral spur, trabeculum meshwork pigmented, trabeculum meshwork non-pigmented, and the Schwalbe's line. Once we show the animation, now we take them into the clinical video. This is called metaphorical conceptual learning as I have devised it. So now when we take them like that, we orient them into the animations in a much better way. So it's more like a cognitive match the following. So you can just match the following and you can orient yourself in a clinical frontier. Slowly you can see we take them from iris process into PAS, because at the beginning, what is an iris process? What is a peripheral anterior synechiae? These are some things which confuse a neophyte. So we show animations of the iris process, then we show animations of the peripheral anterior synechiae here, and then we take them into real-time scenarios where we play the iris process. This is how the iris process looks. And then we show them this is how the peripheral anterior synechiae looks. So this is more like a metaphorical conceptual learning, like cognitive match the following at the beginning of their curriculum. So then these are some pupillary block mechanism where the posterior iris is in contact with the anterior lens surface, and then we show how the aqueous is not able to get its flow through this area and the angle closure happens. I'll just play this animation once again. So these are some basic concepts which we are trying to make sure we cover through animations. So animative learning will make us understand, okay, this is what pupillary block is and this is how the angle is getting closed. So we'll be doing a PI to actually prevent this. So this will make learning more easier and more fun. So initially I started with Adobe Flash version CS5, costs around approximately 2500 is what my animation toolbox is. So just like drawing a simple square or a simple oval. So you just choose a simple square here. So I first draw a square. So once you draw a square, you can just scale it on any axis you want and make it into a rectangle. So once you have made the rectangle, now for example, the rectangle is at 37 degrees in the first frame. So at ending, we have a frame 20. So in frame 20, it is in a different axis. So the software automatically can move it from one frame to another by having its own way, or you can choose your frame 1 to frame 20 on your own. So in the end, you'll have a product like this, which is moving from point A to point B. So in ophthalmology, what we started doing was we started taking reference images. So take a reference image and you can create your own imaging canvas by giving a color to it, a yellow color, a orange color for the choroid, and for white for a sclera. You can choose your color layering. And once you have created your own ophthalmic cross section, it can be done by that, or you can draw two circles and you can erase these blue arrow areas and you'll get the cross section of the eye. So this is one of my patient who had ICL, and he was diagnosed with secondary angle closure glaucoma, and PA was done, but still there was no improvement. When he came to us for second opinion, it was actually an open angle glaucoma which was quite pigmented. So we re-diagnosed him to open angle glaucoma. Yeah, because he had a normal anterior chamber depth, angles were open, there was good ICL vaulting. So we wanted to show him how it really happened in his eye. We showed that once your iris, the pupil got dilated, the ICL was placed. Maybe in the surgery, there could have been a slight rotation of the ICL, and it could have caused the pigment dispersion to actually take place in the first instant. So creating an animation can work wonders in counseling, as well as these mechanism to understand the pigment dispersion in this rare case of ICL can actually be taught for neophytes as well, for fellows, neophytes, or for counseling material too. So how did we go about creating this animation? You can see here, drawing simple circles with a hole in the center for sclera, then adding the blue cornea, adding the vessels for the conjunctiva, and then adding an ICL behind. So this is just a scientific screenplay and more like a flip book where you have one above the other. So when you have one above the other, it's more like a flip book. It's more of a flip that you see that the animation is actually moving. It just images, but it set the ball rolling. So how did we dilate the pupil? Simple dilatation of the pupil can be done by actually enhancing the circle size. So you have drawn a circle. So once you have drawn a circle, that means it's a small circle now. The pupil is constricted. At the end frame, you'll draw a larger circle. It is done by using a tool called the motion tween here. So it's just like drawing a simple circle and enlarging the circle. So in frame 1, you'll have a smaller circle, and in frame 80, that is the last frame, we'll be having a much bigger circle. So from frame 1 to frame 80, the circle enlarges in size, giving the illusion of dilatation. Similarly, we add the ICL implants. As you can see here, the ICL is now added, and then the same mechanism is operated on the multiple levels of this particular layer. Even if you want to zoom one particular area and show how the pigment dispersion happened in the first place, we can zoom without it getting pixelated because it's a vector based animation software. Then for adding these pigments, every layer is for the pigment. For every pigment, we had a single layer. So each pigment was set into moving independently. So now let us see the final product. So the circle enlarges, giving you the illusion of dilatation, and now the ICL comes and it gets implanted. At the similar time, you can see that there is a cross section here which shows how the rubbing is starting to take place, maybe intraoperatively or in the early postoperative period. So then you can see the pigment, each pigment in different layers is set into moving, and how it causes the secondary open angle glaucoma in this case. So this is how we can make concept complex very simple. If you have 5 frames between point A to point B, you can move it quite faster. But if you have 10 frames in between the same point A to point B, it takes a long time to move. So these are some simple tricks that you can actually learn in your PowerPoint, which next Dr. Pavan will be trying to cover. So and Prithvi also and Pranesh will also be covering. So to have laser animations here, you can see that SLT procedures like SLT and ALT can be shown in simple animations where the spot size need not be mucked up. Like people who are having their post graduation, they can be shown where the spot is placed between the pigmented trabecular meshwork and the non-pigmented trabecular meshwork. In SLT, obviously, the spot size is much bigger than the ALT spot size. So all these simple animations and the argon laser peripheral iridoplasty. So this is an eye with normal angle. We show the normal angle first, and then we show how the oppositional angles are. So now we can see that this is an oppositional angle. The angles are opposed. So now we are treating this patient with argon laser peripheral iridoplasty. The laser spot comes, and now you can see it opens up. It does a plasty here, the thermal energy. So it opens up. So we can show these kind of simple animations. So how the laser is hitting, and then you can see it opening up. So this can also be shown from a front on view. How the 24 spots in argon laser peripheral iridoplasty is placed over the 360-degree areas. So first we showed a gonioscopic, a side angle view, then we showed a front on view, then we show the gonioscopic view of the same argon laser peripheral iridoplasty, how it actually helps in releasing the oppositional angle closure by giving the laser at this particular area. So by this, we can give them a holistic coverage of these concepts which are very difficult to teach for neophytes. Then we innovated this particular application IMG3D. I have shared the QR code with you all in my handouts. So in this app, what we started doing was, more the animations we started to create, the more we felt we need to move into unanimations, because animations is for undergraduates, or for neophytes who are actually coming into ophthalmology. But who are practicing people, we felt unanimations with real time, true color, confocal images in 3D will give you a much better area. So we no financial disclosure, but we have given it free of cost. And this is a QR code. It's available in Android. It is developing for iPhone. We have used wide field 110-degree true color fundus images. And for the anterior segment, we have used real gonioscopic structures and slit lamp images. And we use the software Maya LT and Blender to create the 3D models. Not only we stopped with ophthalmology, we started creating neuro-ophthalmic structures as well, such as the cavernous sinus, the circle of Willis, any structure that is undissectable during our anatomy cadavers. These are structures which we don't dissect. So we felt, okay, these are structures which we can work on, and we can create the 3D effect for good dissectable learning, which can serve as simulations as well. So we started creating this app IMG3D. And then what we did is we placed multiple cameras inside the software, and for every camera we gave a button. So you can choose which frame you want. Most of the apps today are very static. You click, it moves like a flip book. It doesn't go dynamic. But the application that we created, IMG3D, you can see once you click the button, the eyeball comes and it gives you an option. Every option is actually a camera that we have placed inside the eye. You click anatomy, automatically the eye goes into the anatomical part, and now you are going to click the anterior segment. So it goes into the anterior segment view. Now you can click angle or ciliary body. If you click angle, you will get the gonioscopic view. Now when you click trabecular meshwork, you get the electron microscopic view. So we wanted to give you as much dynamicity as possible. And now you go to posterior segment, and these are all real images, my dear friends, what we have taken from the patient. You can on and off the vitreous, you can choose fovea, you can choose optic disc. If you choose fovea, it goes into the fovea. So I'm just orienting you with the normal fundus here, and you can have the optic disc. Now, once the normal structures are shown, we started adding all the patients pathology as well. Now, giving a quick glimpse on the pathology. For example, this is a pathological box. You can off the vitreous for better clarity. You're choosing flecked retina. There is a colored image along with autofluorescence and infrared in the application that we have given. So you have a better view of all the pathologies, especially for neophytes, retinal nerve fiber layer defects in infrared as well. We are given a complete atlas: glaucoma, myelinated nerve fibers, splinter hemorrhages, and this serves as a pedagogical transformation for e-ophthalmic learning as well as counseling. Simple YAG-PI, anti-VEGF injections. Patient may tend to ask, why do you need to do a laser for me for YAG-PI? We can show these kind of simple animative videos, and we can tell this is why we want to do a laser. This is why we want to do an anti-VEGF injection for you. To a complex surgery can be counseled with this app. So I feel 3D and 4D metaphorical conceptual learning along with these e-counseling stations are going to be the future of e-ophthalmology. And with that, again, I am just ending this part of my presentation with my YouTube channel. Please do visit my channel and please do give your feedback. It is only with the feedback that we are able to develop these kind of applications and much more. So that is my first part of the talk that I wanted to cover today. It's on animations, 2D and 3D animations. Thank you for your time. Thanks a lot. I'll take some questions if there is anything, or we'll move to the second part of mine. And then we have a live demonstration as well. We'll demonstrate the apps also for you. Any questions, sir? Anything that Pavan you want to add for the benefit of the?
We'll finish off the talk.
Yeah.
Prasanna.
I'll finish off mine, and then we'll have the.
No, we'll finish off all, and then
Yeah,
we'll
fine,
take
fine,
the
perfect.
questions. Yeah.
So I'll move on to the next part of the talk. So the more we went into animations, we felt that the future is going to be 4D. So 2D and 3D we started doing in the form of apps, and then we felt, okay, we'll move into 4 dimensions because ophthalmology is a 3-dimensional structure, and we felt a 3D structure has to be given justice by having a 3D imaging, if not 4D. So then we started inventing the augmented reality application in ophthalmology. Again, this is another one of our apps which is available free of cost. The idea about this app being, why not diagnostics as well? Because the initial applications that we created was not diagnostics. So we felt 2D is slightly not great for beginning. 3D is obviously very enhancing to the eye and very eye pleasing. What if we can give a technology in 4D? So that is Mr. Aji here demonstrating things in 4D, and at any point in time during the course, you can all go and have a live demo. So what Iron Man did is not science fiction. It is, we have brought it into a science-based reality. So once you wear that headset over here, you can actually see the things in real time. So that is what we wanted to make. Seeing the Marvel Cinematic Universe, we got inspired, and we felt, what if we can make our own four-dimensional ophthalmic metaverse? Because in ophthalmology, if you see, fundus and OCT, take for example, they are actually two separate entities. We can't really bring the fundus and the OCT together on a single template. What if we are able to make a fundus and take the OCT out from it, and take all the slices, and whatever slice that we want, if we are able to customize and see, that will be really great, isn't it? So that's where the idea started, to create the hologram. So this is the holographic museum that we created, where you can see him moving through the holographic areas, visualizing the structures. So all these structures are available, and at any point in time, I'll maybe at the end of the session, after the next two talks, we'll have a live demonstration of 5 minutes for all the attendees. So all these structures are available as holograms here. The brain, all the fundus structures, infrared, color fundus, everything is available as holograms. You can use your hand, you can catch the hologram like this. You will be seeing it through your eye when you wear the headset, and through the headset you can actually have a feel of it. It's 4D because you have the hand tracker. You can enhance it. You can view the Miyake Apple view, the gonioscopic view, the electron microscopic view. If you want to go back and view the fundus, you can do that. It's all available on paper, on a thin space. A diabetic patient comes, we do a fundus and OCT. The Once it enters the hospital database, we have this translational software attached to the database. Under 60 seconds, we get the holograms. So now the patients can actually be, the OCTs can also be taken along with their fundus, because we can superimpose one another, and we can choose the layers that we want. What we do in a two-dimensional system, we can actually see it in 4D, and the counseling of the patients can also be done in 4D, where we can enhance our counseling experience for the patient, and make them understand that this is why we need to do an anti-VEGF injection. So once the same patient after treatment, you can see the PRP spots, as well as once the injection is done, the edema has now settled down. So again, these holograms are now generated by doing an imaging, and the same process that I showed with our translational software, we are showing how it resolved. Same patient can be counseled again. So anterior segment tools as well, you can see anterior segment OCT, the fundus OCT, they can also be provided as holograms. So complex surgeries like a posterior polar cataract with anterior imaging, you can actually preoperatively plan with the hologram. You get a 360-degree view, how we can go and approach these patients, how we want to do the preoperative surgical. So not only we wanted to give it in the headset, we also wanted to give it in the smartphones as well, be it an Apple or an Android. So this is one of the phone applications that again I'll be demonstrating to you at the end of the session, where you'll be using your smartphone with the AR template that I have given to the attendees. So you can actually have a application. Once you have installed it in your phone, you can see the holograms in your smartphone itself. So this can actually help you in teaching, counseling. If you don't have the headset, you can also do this phone kind of a thing, where you can see the three-dimensional pictures, and you can choose your frame of choice, and examine these patients. So that is also possible. Complex structures like the cavernous sinus, which can also be seen, can see this is the real time what is happening, and this is the video of the phone display, where the cavernous sinus is been 3D. So you can see now the user is moving 360 degrees, rotating, and seeing the cavernous sinus from different angles, because in theory it is only possible that we see only two-dimensional slices of these kind of complex structures. So augmented reality systems also, we have made all these models possible: fundus, cerebral venous sinus, circle of Willis. The main highlight of our feature is we have used real patient images like the gonio, the fundus, to create these structures. We have published this in Indian Journal of Ophthalmology. To summarize my discussion, my dear friends, we have filed the provisional patent for our applications, and it's useful in 4D ophthalmic diagnostics, 4D telemedicine, 4D AI, toolbox creation, multimodal imaging for retina examination, and you can see any retinal pathology can be examined with the color, autofluorescence, and infrared, such as the retinitis pigmentosa, which is shown here. This is a color. So you can catch it, you can feel the holograms, and you can examine it in 4D. And low vision rehabilitation counseling, useful for neuroanatomy pedagogy, complex neuroanatomy structures uh, that we see in our routine practice, maybe for in the beginning stages of our neuro-ophthalmological clinics. can be studied. All the nuclei are available, cranial nerves, complex neuroanatomical pathways are being made in 4D, so that we don't need to mug up the concepts and we can have a good immersive cognitive learning. So with that, I end my discussion, I end my talk. We'll take questions at the end. I'll also do a quick one-on-one demonstration for the attendees. I'll hand over the session to Pranesh. Pranesh, you can take over the keynote presentation. Thank you, Pranesh. Thank you for your listening.
Thank you, Prasanna, for that wonderful talk. And Prasanna, I think you would have invested at least 3 years for this, no? 3 to 4 years. And I could always, like, I'm seeing Prasanna from the beginning, and it has become his passion. And the way he presents and the way he owns the discussion, I just love that his passion, and I always wish him all the best. And we expect more and more. I know you're working on 5D, 6D and all. Someday 10D will also come, I think.
Thank you. Waiting to hear you too.
Sure. Dr. Pranesh is finished his residency from Arvind Hospital, Madurai, and now he's pursuing his retina fellowship in Arvind Hospital, Coimbatore. And he runs a YouTube channel which is very famous among the students, and he's going to give a talk on animations and how to create this animation using simple routine devices what we have.
Thank you so much for being here. The very first IC of the very first day. It's always a great pleasure to be here. And I wholeheartedly thank the audience for being here. So, Dr. Venkatesh Prasanna is my mentor, is my guru. He's someone who I really love, I take a lot of inspiration from. And now I add Dr. Prasanna Venkatesh also to the list. A huge fan. So after the 4D, 5D and 6 dimensions, I'm going to talk about only one dimension. I'm going to take everything to old school. So after an overwhelming technological blast, it's going to be completely Zen. So before the end of this talk, you will all learn a technique, a hack, which can make your next presentation much better. With that, the keynote presenter, how to modify slide presentation for no more virtual. Thank God. We have stopped being virtual, going offline for the ophthalmic webinars. I'm Dr. Pranesh, and I want to bring in 4 questions before we move further. This is the order of significance. Before even we start to present, it is important to ask ourselves, are we answering these 4 questions? Why, who, how, and what? You see, I've cut off that what. Content never matters when it comes to presentation. It's first and foremost is we should understand why, the purpose, why are we presenting in the first place. Then comes who our audiences. Catering to the needs of the audience is going to be the ultimate way to go about. And this talk will focus on the how or the techniques to make the presentation much better. I'm going to share a few rules. Rule number 1, please plan on a piece of paper. I know after the technological blast and the title being keynote presenter, this guy is asking you to go back and take your papers out. But nothing works better than planning our talk on a piece of paper. How many of us open up the slides immediately and start preparing for presentation? Any experience with that? Great. So we're all in the same shape. We do that. It's very tempting to open up the PowerPoint, adding slides, copy paste from a PDF or somewhere, or even we can even get or borrow PowerPoints from others from SlideShare. We start modifying that. But nothing works better than planning on a piece of paper. This is the rough work I did for the talk, which I'm giving currently right now. So after this rough draft, I made a proper classification of topics, how to go about, how should I structure my talk for this. If you are a techie, you can use Mind Map, which is a brilliant software. Plenty of them are available for free. And you can use this Mind Map not just to teach, but also to learn Ophthalmic in a better way. Xmind is a brilliant software. There are multiple others as well. And you can even use that particular software to present. And that brings me to rule number 2, classify the content. Like how we divide and conquer the cataractous lens, let us all classify the topics one by one in a piecemeal approach. Divide the big cake and feed the audience one piece at a time. So what I'm saying is all common sense, but most of the times the common is going to be more uncommon. This is the presentation material which I made for my residents on ocular TB. So on a piece of paper, I write everything, I add images, classify the content, and I present from the very same document. I hardly use PowerPoints to teach my residents. So I use this app called Notability. If there is one investment which all ophthalmologists should make is get an iPad. And if there is one app which all of us should buy, it's going to be Notability. Okay, it's paid. If you want a free, there are multiple options as well. We have OneNote by Microsoft, again catering to the needs. Why? Because Notability gives us so much flexibility, so much simplicity, what a PowerPoint failed to deliver. I know I'm being hypocritical. I'm talking about Keynote Presentation. I'm talking about the use of Notability. But the reason why I'm saying this brings me to rule number 3. Please avoid PowerPoint poisoning. How many times have we seen this kind of slides in every conference? Any experience? Yes, all of us. That is the most important thing. I understand PowerPoint is a brilliant tool which makes our lives a lot more easier, but unfortunately it's being abused, misused to the core. This slide talks about PowerPoint simplicity, but please have a look at the slide itself. How crowded, how difficult it is for us to read. It's always important for us to understand that slides are never a substitute for the speaker. If the students, if my residents or fellows can read everything from the slides, then my presence is not at all needed. I can very well move out of this hall and we can ask them to read the slides as well. Boring slideshows never help us to learn science properly. So how to go about it? I understand we all use PowerPoints, and what I do is I make use of this presenter notes, something which is very underrated, underused. So this PowerPoint presenter notes is available both on Keynote for Mac as well as for your PowerPoint. And here you can go and you can write your notes. So the presenter will see this slide, whereas the audience will see only this slide. So it makes the slideshow much more interactive. Instead of just reading from the slides, I can show what is here and I can read from here. But unfortunately, you need 2 screens for this. And since most of us are got used to Zoom, there's an option to select a portion of the screen. What I mean is, go to Advanced, click on the portion of screen on your Zoom. Then what you can do is, you can just select only this part, only the slide part of your entire slideshow. So what the presenter will see is the entire thing, but what the audience will see is only this point. I hope I'm clear here. This is another very useful way. So that what I can do is I can just present, by just looking at the slide, I can just talk to the audience. But the audience will see only this. Only my slides, not my text. It's yet another brilliant way to make our presentations sound much better, and you will also appear much more smarter. Enough with the slideshows. Let's talk about emotions. The great man Aristotle gave us the 3 elements of oratory: ethos, logos, and pathos. Ethos means credibility. Logos means logical argument. As ophthalmologists, as medical scientists, we focus on ethos and logos, but how often are we focusing on the emotions of the audience? That is pathos. I'm going to the old school again. By telling vividly engaging stories to our audience, we can make our presentations much more memorable, and that is going to be the message of this talk as well. Please engage the emotions of the audience by telling stories. And fortunately, our ophthalmology, our medicine has integrated stories through case presentations. So what is the summary of this talk? Please keep it simple. Simplicity sells. It's all about impressing or respecting your audience. Give messages, the take-home pearls. And please remember, PowerPoint kills if it's not being used properly. It's like fire. And always level the lecture. Take lectures one step at a time. Give the students in a piecemeal approach. And last but not the least, it's the emotions which appeal the audience more than anything else. This is my YouTube channel. I think we have been sharing lots of YouTube videos, but there is a playlist where you can access on teaching alone. And I hope the respected seniors and the esteemed audience in this group would find it useful. Thank you so much for the patient listening. Let us all teach to reach.
Thank you so much for coming to our IC. In this talk, I'll be talking about how to direct an ophthalmic movie for Film Festival and Premier League. So all of us will always be wondered by seeing a great movie, and we always watch it and we never think it how that great movie was made. So for a great movie, the basic thing always remains the concept, then how the script is written, then how it is convinced on the screen, then how the impact was given with the background music and the narration. So this makes a great movie, and we can use the same concept to make a great ophthalmic movie, and adding some amount of entertainment will make it a Premier League movie. So my first suggestion is always be prepared. Even before the submission date is there, whenever you're free, just make a movie and keep it. And whenever the concept arises, once your movie is ready, there are so many conferences happening in a year, both virtually, now physically also. You can submit for any of the conferences which are coming. So the best idea is always make a movie when you're free and when you have the concept, and keep it ready. We have to always look for the eligibility. Each conference has their own specification. We have to be very much aware of it. Most movies in all the conferences expect us to make about 8 minutes or less. My suggestion is to make a shorter duration. It is better because the attention span is very small. We can add a small script, make a shorter movie, and later if we want, we can enlarge it. Financial disclosure is very important. English narration, either we can give ourselves, or we can ask any of a friend who has got a very nice voice, or we can even hire a professional. The first movie is one of the resident who
Glaucoma surgery has seen significant innovations over the past 2 decades in the form of modifications to penetrating.
So this was the voice taken up by one of the American resident who visited our institute. And this is, so this we hired a professional to give the voice. So it depends on what is your preference. The main idea is the narration should be clear and crisp so that the audience understands. Next, we have to know the judging criteria. Usually, what are the factors they consider when they are judging it? The applicability and education values remains the basic. Then it should be original. Then scientific content. What is scientific content? What is it validated at this present point of time? How clarity is the picture? Cinematic quality and artistic effect. So in the application education value, we can make movies on innovations. It can be technique, device, or system. The quality teaching, history and review of literature, interesting cases and complications. So this all can make a nice movie. The first movie is based on a technique of XNet, which also won an award. The second was a device, which is a virtual reality based perimeter. And this a system. A system is family screening. How do we do a family screening in our institute? So these are all award-winning movie. It is how we make the concept and how it is applicable. Next, this is one of the movie which won an award in ACRS. This is on what are the tips for the beginners, how to do trabeculotomy. So by giving 3 simple tips, the quality of the video was so good and the narration was so good, it won an award in ACRS last year. Then this was in history and review of literature, just various uses of fluorescent. So just by demonstrating what are the uses of fluorescent, which all of us know, but the nice demonstration also won an award in ACRS. Then we have to keep concentration on audio editing and technical part. Just we make a movie and we don't work on this technical part, that can become a major barrier for the movie. As in this movie,
COVID-19 pandemic has become a major hindrance factor in the treatment module.
as we hear that the background voice is so much that the narration is hidden. So we have to be very clear that what we want to convey to the audience. The audio should be clear. The background music should be very minimal.
COVID-19.
Then we can use various artistic effects. We can use infographics.
We did a prospective problem on visual experience randomized into 2 groups.
A study which is shown as an infographic will convince the audience better.
following which they undergo the surgery with intraoperative vital signs monitoring.
And we have to make sure that when we are shooting the movie, the lighting should be adequate. Like when we shot with our smartphone, the lighting will keep on, brightness will keep on adjusting. So we have to be very sure that our brightness should be fixed, and should have adequate lighting so that we can appreciate the contrast. Then we can use various animation. It can be 3D animations or it can be 2D animations. And we can use various effects. So what makes a good video recording? We have to make sure that it should be clear. It should not be focused out. And it should not be decentered. Here the prime interest is taking a trabecular flap, but it is decentered. All these other things are seen at the center. So we have to make sure that it should be well centered. And we should adjust the brightness. It should not be too bright so that the audience doesn't appreciate what we want to tell. It should be well centered, like it is shown in this picture, and it should be clear, and it should convey what we want to tell to the audience or the judges. So the best way for that is when we are doing a surgical video recording, we'll be more concentrated on doing surgery properly. So it's better to have a TV monitor towards the foot end of the patient. A assistant can see the TV well, or we can have a dedicated assistant to keep watching whether it is centered, focused or properly, so that we can have a good proper video recording. Then we should get used to our foot pedal. So whenever there is a little decentration, we have to adjust it accordingly. And we have to always show the area of interest in the center. So in this movie, we just wanted to show how you do a vectis delivery of the nucleus. We know if it is in a large zoomed view, we cannot see the vectis insertion delivery of the nucleus. So what we should do is we should come out like lesser the zoom, then we can show how the vectis is inserted and how the nucleus is delivered. So that should be our primary area of interest, and we have to adjust accordingly. Here in this, just how do we prolapse the nucleus? By doing this rotational action. So we have to focus the center properly. So avoid non-essentials. Like when we are doing a trabeculectomy or SACS, whatever it is, the parameters on the phaco machine is not important. So we don't have to show all those parameters. We can just take off those parameters so that the audience or the judges don't get diverted for these unnecessary things. So the best way is to take off this overlay which is connected to the machine. So we have to understand our camera settings. We should know how to adjust the white balance, how to adjust the brightness, and always we should check the output file. So nowadays we all see the widescreen. So better to have a 16:9 compared to 4:3. Better to get with the full resolution, like full HD 1920 by 1080p, so that we can reduce the file resolution later to decrease the size of the file. We should always record in the best resolution. And always we should showcase our best video recordings. So in conclusion, we should have a good concept, convincing screenplay, good narration, suitable background music, add minimal but suitable masala that makes a recipe for an award-winning movie. Thank you.
Thank you so much, sir. So we have come to the end of this instruction course, and I thank the esteemed audience once again for being here. The interested audience can meet Mr. Raji, and he will be happy to give a live demonstration of the 3D augmented reality. Please. So over to the next instruction course.
Yeah, we'll conclude the session, and we thank all of you for attending this instruction course and inspired us. Thank you.